Welcome back. Today we'll discuss more tips for your 15-minute doctor's visit. So the first tip is to bring a list of all your medications with you to the doctor's appointment. If you know all the medications that you're taking, including the name of the medication, the dosage, the time of day you need to take them, and why you're taking them, and you're only taking 2 or 3 medication, maybe you don't need that list because you'll be able to, easily tell your doctor what medications you're on. However, most patients are taking upwards of 5 or 10 medications, and it's easy to forget what they are and what time of day you need to take them or the dosage. So it's important to type up a list of your medications or write them down to bring them with you to each doctor's visit. And if you've started on any new medication, if you've seen any specialists and they've given you any new medication, you want to make sure you update that on your list to bring with you to the doctor. If you're a caretaker and you take care of your elderly mom or your aunt or some other family member and you bring them to the doctor, also make sure you bring a list of their medications as well as their pill bottles. I cannot tell you how many times patients come in and I ask them what medications they're on, and their response to me is, I take that little red one in the morning and the blue one. Which one is that again? The blue one, yes. And yes, some days I take that white one and my feet get swollen. They just tell me their pills by their color, and I'm just going to tell you straight up. For me, I wasn't trained to identify pills by their color, and I think I speak for most doctors that's not our specialty. And even the pharmacists, even though that's their job to fill your prescriptions and identify certain medications, it might be difficult for them by just telling them a red pill or a white pill, because I'm sure there's plenty of red and white pills or blue pills out there. So it's very important for you to make a list of your medications and bring it with you to each doctor's visit. The other thing is sometimes when patients bring me their pill bags, I find a lot of medications that are expired, that were discontinued or should have been discontinued, and some of them are just contraindicated to their health and very dangerous, for them to take. And so it's important to have an updated medication list so your doctor could constantly review those at each office visit to make sure that you're taking the medication that is right for you, that is safe for you. Another reason to bring your pill bottle is to avoid any mix up with medications names. Sometimes when I ask you what medications you're taking, you might give me a name of a medication that might sound similar to something else. I don't like to put things in your records unless I'm pretty sure that's what you're taking, the right medication, right dosage, and the right time. So it's important to bring that list, bring that pill bottle, and then that will definitely clarify whatever information we need to have. And sometimes these medications are just downright hard to pronounce and hard to spell, and it's hard for you to identify them or say them correctly, and so that list will help you out. The pill bottle will also help you out so that no mistake is made there. So yes, please bring your medications. What will often happen is that if you didn't bring your medication list with you, I would have to spend time doing the office visit calling your pharmacist or your pharmacy try to verify what medication was routinely filled for you within the last month or two, what medication was newly started and what doctor might have ordered it. And so you can see how this can take up time doing that 15-minute office visit by me trying to verify and triple check or double check what you should be on or whether or not that's the correct medicine. And also it takes time for me to make sure that those pill bottles you bring are actually stuff you need to be taking. But that is just a necessary part of the job, because I don't want you to take pills that are expired or that are dangerous for your health. So please go ahead and bring those in. If you keep your list up to date each time and add any new medications that you're taking to the list, then that will make for a smooth transition during that part of the visit, and that will take less time and allow me to be more efficient in taking care of you so that we can get as much done in that 15 minutes as possible. also caution about changing your pharmacy frequently or using 2 or 3 different pharmacies, because once again, this is one of the ways that, especially, I especially use to identify, some of the medications you might be taking. And if you're using 2 or 3 different pharmacies, then I'm having to call around and ask different pharmacies about the medications you're taking. And then you also want to let your doctor know any supplements or vitamins that you're taking, because some of these can be contraindicated to medications that you're taking or diagnoses that you may have. Once again, I hope you found this helpful the next time you visit your doctor. Until next time, take care of you, and I will see you in the next video.